what am I going to find here?
Aortic.
Aortic, right? Across from it, pulmonic. And which one is greater here?
S2.
S2. Then, very underneath that, on the third intercostal space, what am I going to find? Erb's point. And then, on the fourth intercostal space, what am I going to find? Tricuspid. Just below that. Just away from the sternum, you're going to find it. You all can feel your sternum, right? Very next to it, you can find the your tricuspid. Okay. Now, where can you find the mitral valve? Mitral valve is the mid-clavicular. You guys can all feel your clavicle, right? Mid-clavicular that goes down. You're going to find the fifth intercostal space and put your stethoscope right there. Right? It's not easy, but when you do it, it would be easier. Okay? So, mid-clavicular line on the fifth intercostal space, left side of the sternum, you're going to find the mitral valve. And where S1 is greater than S2. Okay, and then you're going to hear the lung duct there.
Is that the apex?
Yes, that's the apex of the heart.
Is where we hear the mitral valve?
Yeah.
Okay.
Yes.
So the mitral valve is the apex. Oh.
That's where you find. And also checking for apical pulse, that's where you're going to do it. Because it's at the apex of the heart. Right? So that's where you're going to find the apical pulse as well.
And do we just count, or how do we?
Yes.
Okay.
You're going to count for 30 seconds and then move forward. Okay? Only thing you also have to remember, only do it for 30 seconds. Do not go more than that. But in real people, you're going to take 1 full minute. Okay? Then, you're going to, we already identified the apical heart rate. Then I'm going to look it for abdomen. Okay? I'm going to look for abdomen, just assessing it. I didn't hear that. Now I'm going to look for abdomen. What am I going to look for abdomen? Just the symmetry, right? Any discoloration. I see there are some stretch marks there, and that's okay. You're going to write that down. Why do you have to put each and every single thing down?
So it doesn't come back and bite you
It
in the
doesn't
butt.
come back and bite you, because documentation is very important. If I forget, oh, that's a, stretch marks, I'm not going to do that. What if it's a abuse there, right? Or something happened while in the hospital stay, and the patient comes in, I didn't have this. What if the person is trying to protect the spouse or something? It happens. You have to document every single thing, okay? Then I'm going to look for, there are stretch marks there, looking at the abdomen, looking at the symmetry, it looks symmetrical. She has a ring here, right? And you're going to document that too. Because what if it gets misplaced, right? It's going to come to you. So you're going to document, and then also mention what kind of ring is that?
Silver ball.
Silver ball, right? If it's a person would say, oh, I came up with diamond ring here. Mm-hmm. Do you think I'm coming up with all that? No. Patients do come up with these complaints. You have to document that. Then, then hearing the bowel sounds, right? Where am I going to hear the bowel sounds? On the 4 quadrants. You're going to divide the abdomen. This is your abdomen, right? Abdominal cavity. I'm going to divide that in 4 parts. I'm going to put a stethoscope here. You're going to hear what? Right? It means your bowels are moving, right? Soon as you hear it, you move to the next one. You hear it. You're going to the other one, hear it, and then going to the other one. As soon as you hear it, you're going to say bowel sound present and active, right?
We don't need to count like per minute.
No. Usually it should be, you should be hearing it within 5 minutes. You should be hearing it. But 5 minutes. But in us, you can hear it faster because we are more active. But patients who are older, their metabolism is slower, you can barely hear it sometimes, right? So that's why you have to at least give 5 minutes to do that. If it's people who have diarrhea, it's hyperactive for them. You hear it even outside, people hearing it, grrr, right? That means it's hyperactive, right? If it's hypoactive, it means very slow. It's maybe there, maybe not there. Or if you do not even hear it for within 5 minutes, it means it's absent.
So constipation would be,
Constipation could be there. That one.
okay, if you don't
It could
hear
be a
it.
bowel obstruction there, right? So your documentation is very important because you can identify what can causing that, right? Then moving forward, you're going to do light palpation of the abdomen. How are you going to do that? Just very lightly. And usually you do it after doing auscultation, observation, inspection, everything after you're going to do the palpation because it can cause pain, right? And ask a person if you feel any pain, let me know, okay? You're not allowed to do deep palpation, why? Only nurse practitioners or doctors can do that. Because what if you misplace something in there? No, I'm just kidding. What if you trigger something in there? Right? And then, sometime when you do a little bit of deep palpation, you can feel, if you're in your monthly cycle, you can feel your ovaries too. Yeah. So if your periods are going to come in, or
Am I gonna be feeling something?
little bit swollen, this one is little bit swollen.
Pick it up.
And now this one, it's
What is
time. Okay, then I'm going to look at the IV side. I'm going to look for the IV side and say, oh, IV is intact, no discoloration, no redness present. Okay? Then moving forward, I'm going to check for radial pulse. Everybody knows how to check radial pulse. You're going to have you seen people doing it at the same time?
On both arms?
On both arms. People do that. That's bad practice. Because what if I have some arterial or peripheral insufficiency on one hand is fine. Which one are you going to count? Right? So you have to do it separately, not at one time. Right? So you're going to do it for 30 seconds and then move forward. Okay?
On each arm, you're gonna do 30 seconds, 30 seconds.
Correct. But
Times
if
2.
your instructor is nice,
Yeah.
I'm not.
then she's only going to let you do it in one arm and then say you move forward, right? Because you're wasting time here. Then you're going to look for skin turgor. Here I'm going to pinch it. It's not even pinching, it means skin is intact, right? Then I'm going to do the sensation, touch, and movement of the hands bilaterally. So what I'm going to do is scratch. Okay, I'm going to ask you to close your eyes, and then I'm going to poke her with it, right? So tell me what you feel. Felt the poke, right? Rough.
Soft.
Soft, right? So she has the sensation. She knows what we're doing, right? And you're going to do it on the other arm as well, right? So it means it's all fine. Then I'm also going to touch the skin. It's warm to touch, right? And then I'm going to ask her to, what do you call this?
Abduction.
Abduction, adduction. Abduction, adduction. You're going to see if person feels any pain. Person complains of pain, you stop it. Then we did the movement of hands bilaterally. You do not have to do that. But temperature, I did it. Muscle strength. How am I going to do that? Ask a person to squeeze my hand. I'm going to put my fingers here and ask her to squeeze. Don't squeeze it too hard, otherwise I'll slap across your face.
Abuse.
She's so cute.
Then I'm going to check for capillary refill. Do you guys,
Or
you
the
can
art
record that, right?
Teacher.
Then you're going to check for capillary refill. Do you guys know how to do it?
Yeah.
Okay, you're going to, and it should be less than 3 seconds. Perfect. Then I'm going to check for dorsalis pedis pulse. Have you practiced it before?
No.
Didn't you guys do it when you guys were doing pulses?
Mm-mm. We haven't done pulses.
Didn't they do it in bridge nursing?
We did like the radial pulse, but that's it.
You should be doing all the pulses. Didn't you have the homework for vital sign homework?
Yeah.
It has dorsalis pedis pulse. You should be practicing those.
Yeah, we know where it is, but we
Yeah.
have, I think I haven't practiced
Okay,
touching
you
it.
need to start practicing.
Okay.
Do you know where it's? I want
Yeah,
you to
isn't
take
it like
it.
It's on the
right
top.
At your own
Mhm.
risk.
Give me a mask. Yeah. Okay. On top of here, you're going to find the dorsalis pedis pulse, and you guys are going to practice it.
Okay.
Right? Sometime. It is hard to find it, but you have to find it because it's not that you're going to fake it and say, "Oh yeah, I found it," and your instructor would be there too. Okay? We know you. So that's what you have to do. Dorsalis pedis.
So do you do the posterior, or what is it, the,
Thumb and,
Tibia.
like, yeah, I know you feel sorry.
you don't do that, posterior tibial? Just the dorsal?
No. Only thing you have to do is this one.
Dorsal.
Dorsalis pedis.
Kind of higher there?
Depends. Sometimes you can feel it up there. Sometimes you feel it a little bit on the lower side. Yes.
Talking about an IV, like you pretend to have
You
an
pretend the
IV,
person has an
and then
IV.
you check if it's intact or red
Correct.
or edema or.
Yes. You check for edema, redness, discoloration, and then you do that. Okay? Then, going to feet, I'm going to do the same thing. Ask her, what do you feel? Soft? Rough. I'm going to feel the temperature. Do not put your fingers for temperature. Use your back side of the
Right on the task. Yep, we know now.
And then I'm going to check for ankle edema. See any edema present. And then I'm going to do the muscle strength. How am I going to do that? Have her push on my hand, which I'm not going to do that.
You want
Because I don't
some,
want to pass out. And then that's it.
That's all of it?
And capillary refill too, of course.
Wait, do we have to do, like, the back still, right?
Muscle.
Okay.
Oh, yeah, the sequel.
Right. Then I am going to put you back up. And then, oh, that's 11, I have to go on
That's
the
rough
class.
after laying down.
Then what I'm going to do
How
is,
about showing?
how you're going to do
you're
it
fine.
is,
If you have the
Sorry. Okay, so you feel it here. That's the first intercostal space. Second intercostal space. Third intercostal space. Fourth intercostal space, and then you're going to go down and goes on side, right? Same thing you're going to do. You're going to feel it. You're going to do second. Leave the third. Go on the fourth. Fifth, you're going to leave it. Of course, sixth one should be somewhere here. Sixth, you're going to leave the seventh. You're going to go on eighth, and then go outside and do it. Does that make sense? Do not put your stethoscope. Of course, this is your spine, right? Everybody has one? Okay, good. And then you have,
Scapulas.
do not put your stethoscope either on the scapula and also on the spine, because you're not going to hear anything. You're going to just hear bone, right? So do it where this just a tiny space there. You have to do it.
Do we need to percuss at all?
You do not
Good.
have to do that. But
Yay.
percussion is easy.
Right.
I just,
And sometimes you can even feel that your bladder is full or you're constipated. You can feel that. And that would be embarrassing, right? Because it should be a resonant sound that going there and coming back. You can hear the air goes through when you tap it. You know, the noise goes through. On the bones, on the organs, you would not be able to hear anything. It's a dull sound, right? Because it's a organ there,
Mhm.
right? Or a bone there. If you're constipated or your bladder is full, it means that space something occupied it, so you hear a dull sound at that time. So you ask a person, you better go and void.
Mhm.
And then after that it's fine. You have to do that. And then of course you're going to look for sacral. You're going to look for any pressure, any redness, any discoloration. And that's it. You have to do all that in 20 minutes. So start practicing now.
so you don't have to look at the butt or do any.
No. Okay, other thing I want to mention.
No,
One more thing. Man, one more thing. It's not in your on your
Paper.
assessment, but one thing I want to mention it to you. This is called right the tuning fork, right?
Renee?
You should not be. You would never ever do that unless you would go for your nurse practitioner.
Okay.
But I don't know, for some reason it comes in the NCLEX. What is Weber test and what is Rennie test? So I'll just demonstrate to you and name it what it calls, so you would know when if it comes to you in the NCLEX. I don't know why it still comes in there, but it still comes, right? So we just have to follow that. So first I'm going to do Weber testing. What's the Weber testing? I'm going to do not hold it from here, hold it from the tail of it, okay? And I'm going to, when you stop hearing it, let me know. Okay, so, and she heard it on both sides. A lot of time, but I was, when she said stop, I was still hearing it a little bit. Why? Because it's in the air, right? Bone, it absorbs it, right? So that's why, but it was equal on both sides. It should be equal on both sides, okay? If I say, oh, I heard it on one side, the other side, you know, I heard it and it's still going on and on and on, it was not equal. What does that mean? Maybe there's a hole in your ear, right? That can happen. So you're going to do that. Then I'm going to do the Rennie testing. And you put it on the bone. When you stop hearing, let me know.
Which one is this?
Still hear it?
Mm-hmm.
Mm-hmm. So it means bone absorbs it, air still conducts the ear.
What is that called again?
This is Rennie testing.
Ready?
R-E-N-E.
Renning.
And then stop, right? So bone absorbs it, air still goes through, right? So air conduction is greater than bone conduction. Got it now? Okay, I'm done, I'm going.
Thank you.
Right.
Thank you so much.